In our fourth and final section of encephalitis, now we will talk about two other conditions, which are the sclerosing panencephalitis and the rubella panencephalitis. One is subacute sclerosing panencephalitis and the other is progressive rubella panencephalitis. And then we will also talk about the diagnosis and treatment of these two conditions. So subacute sclerosing panencephalitis. Rare chronic progressive demyelinating disease of central nervous system, which is associated with chronic non-permissive infection of brain tissue with measles virus. So this is the condition caused by the measles virus. So rare chronic progressive demyelinating disease of central nervous system associated with chronic non-permissive infection of brain tissue with measles virus. The incidence of subacute sclerosing panencephalitis is declined due to the measles vaccine. So with the decline in the measles as a result of the measles vaccine, this condition is also declined because it is associated with the measles virus. Progressive neurological disorder can occur along with this condition. The initial manifestations are poor school performance, mood changes, personality changes. So all these are the initial manifestations of subacute sclerosing panencephalitis, poor school performance, mood changes, and personality changes. Signs on progression of the disease are the intellectual deterioration, focal or generalized seizures, myoclonus, ataxia, visual disturbances. All these neurological manifestations are associated with this subacute sclerosing panencephalitis. There are personality changes, mood changes, decreased intellectual level, intellectual deterioration, myoclonus, seizures are present. Later symptoms associated with this are the patients, they are unresponsive, quadriplegic and spastic, hyperactive tendon reflexes, and extensor plantar reflexes. So all these are different reflexes which are present later on as the disease progresses. So quadriplegic, all the four limbs, quadriplegia, quadriparesis, decreased sensations of all four limbs are present. Diagnostic studies are MRI, often is normal in the early stage. Areas of increased T2 signal in white matter of brain, also in brainstem as disease progress. Electroencephalogram, non-specific, slowing with the disease progression. Characteristic periodic pattern, sharp, slow waves, followed by periods of attenuated background. So all these are the changes that are present on MRI and electroencephalogram. Also, CSF, cerebrospinal fluid, is acellular, normal or elevated, mildly elevated protein level, marked elevated gamma globulin level, and CSF anti-measles antibodies invariably elevated. Oligoclonal anti-measles antibodies are present. Next, the diagnosis is measles virus culturing is done from vein tissue using special co-cultivation techniques. Viral antigen identification immunocytochemically, viral genome detection, in situ hybridization, PCR amplification. So all these are again different diagnostic tests. We have measles virus culturing, viral antigen identification, viral genome detection, and then we talked about different methods how we can do that. No definitive therapy for subacute sclerosing panencephalitis. Treatment with isoprinosine alone. Isoprinosine combined with intrathecal or intraventricular IFN alpha prolong survival and produce clinical improvement. Next condition, progressive rubella panencephalitis, that was associated with measles virus. This is with the rubella virus. We have extremely rare disorder, primarily affects males with congenital rubella syndrome. So people who have congenital rubella syndrome, males are affected with congenital rubella syndrome. There is development of progressive neurologic deterioration. Manifestations are similar to subacute sclerosing panencephalitis. CSF is mild lymphocytic pleocytosis present, slightly elevated protein, markedly increased gamma globulin, rubella virus specific oligoclonal bands are present. No therapy, prevention via live vaccine is done. So that concludes our topic of encephalitis, in which we discussed in detail all the causes, types of the viruses, how they present, clinical manifestations, and then some other conditions like chronic encephalitis and subacute sclerosing and rubella panencephalitis. So thank you for watching scardia.com.